Hi, I'm Dr. Jerry Hesch, a physical therapist in Aurora, Colorado at the Hesch Institute. And this is my client Chantel, who is kind enough to let us use her as a case study. And what I'm demonstrating with her is a complex sacroiliac pubic joint pattern. And she presents with an anterior ilium on the right side. And so I don't know if the camera can see this or not, maybe from a view over here, but the right hemipelvis is lower. And this is not necessarily a pattern from the sacroiliac. It can simply be the whole pelvis being twisted on the hip joints and with the trunk. But it twists and is fixated in such a manner that she has lost normal posterior mobility. When I try and induce passive movement on the right, the motion is blocked using a reasonable amount of force, whereas on the left side that does move. Okay? Now, if you would lie on your stomach, please. So we test in prone also, and if the right side is rotated anteriorly, then we would expect movement when I go into superior glide, and that's exactly what we have. We would expect motion to be blocked going inferiorly, and there is no give when I apply 15 to 30 pounds of force, which is a reasonable amount of force to induce motion there. Now on the left side, she is rotated. We tested her, a while ago, and there's asymmetry here, the left being lower. And if I hook the upper part of the ilium and try and take up the slack, there's no give. If I come over onto the right side, I can take up slack and induce further anterior rotation. So we're calling the left side also twisted in a manner that we call left posterior ilium. Now she can spring inferiorly. I see her feet bobbing up and down because the force is translating through the pelvis down into the hip and lower extremity. When we come down here, there's no mobility in superior glide. Okay? Now she has several patterns going on. Let's have you lie on your back again. The pubic joint is involved, and this is a pattern that I described 30 years ago or more. It's not in the literature. Most people confuse an upper pube rotation with this pattern, but this is a pure posterior glide of the pubic joint. So the whole left face of the pube is posterior in relationship to the right. And I don't think the camera's going to be able to capture that difference. But here's the top of pubes, which is symmetrical. And here's the width of the pube. And maybe you can do a top-down view. I don't know if the camera will capture the depth or not, but my left thumb is deeper than the right. And that's on the upper middle and also the lower portion of the pubic joint. And when I come across to the right, I climb up onto the right pubic bone. Let's have you lie on your stomach. And so with that pattern, the left sacrospinous ligament, the one that's almost horizontal, that one will be tight. And it is very tight. We tested this earlier. And the one on the right I can indent and spring. Okay? She also presents with what another pattern I discovered called a lower windswept pelvis to the left. So it's almost like the lower part, it's like the ischia had shifted over to the left. And of course the whole hemipelvis participates in that, as does the hip and the entire pelvis. There's only a very minute amount of movement going on in the SI joint with these patterns. Much of this is the overall pelvis moving. So if you could come down here, you'll see that the crease of her clothing matches the midline gluteal crease. Okay? And if I come in and capture the medial aspect of her ischial tuberosity, and maybe want to get at the foot of the table, hopefully you can appreciate that the left ischium is lateral. So there's about this much space here, but a lot less space on the on the right side. And there's no spring mobility when I try and take up the slack in this direction. They're both at end range, so there's no spring mobility on this side, and in the opposite direction that's also true. Going back to speaking of the posterior glide of the pubic bone, that would make the left ischium posterior, okay? And I cannot take up the slack, I cannot spring the left ischium. On the right, I can easily take up the slack in that pelvic structure. And then I can easily spring and get a recoil on the right side. And the last piece of this pattern, in terms of what's going on with the pelvis, actually there's two more things going on, and that is that my right finger is higher up into the sacrococcygeal sulcus. So she has a left side bent coccyx, making the sulcus deeper on the left side. Now, of course, L5, we could spring the spinous process of L5, and we would find that L5 is rotated to the left following this pattern of the pelvis. So we would find that the spinous process would be shifted over to the right, and it would have reduced spring, and in fact I can't get any spring mobility pushing from the right to the left. And if we come up to L4, then there's free and easy ability to take at the slack and to spring. Now she does rotate left up at T6 also, and T6 has blocked mobility when I try and spring right to left, but up high at C1, also named the atlas, she counter rotates to the right. And I want to say that some people blame this mobility on the SI joint. It certainly seems to involve a small degree of movement in the SI, but also a larger movement that has to do with the entire pelvis moving and with movement in the hip joints as well. And of course, if there is movement in the pubic joint, then there surely is movement happening at the SI joint. So if we're able to straighten out that pub joint, then I would state that without a doubt that we did in fact restore mobility in the pubic joint and in the sacroiliac joint. But it's very hard for us to measure little small motions and attach a number to that in terms of the sacroiliac joint. But what we can perceive is blocked mobility going through the structure or excessive mobility. So it's going to take me a little while to treat this pattern, and I'll go ahead and treat it, and then we'll come back and film the response to treatment. And my point was to show the complexity of some of these presentations, and this is a very good example of that. So rather than giving it a single diagnosis like right anterior ilium, we actually came up with that plus a left posterior ilium based on blocked motion, left side bent coccyx, left lower wind swept pelvis, and posterior glide fixation of the left pubic bone. So thank you very much.